The honourable member for Dartmouth North.
Madam Speaker, my question is for the Minister of Health and Wellness. This province spent $126 million last year on travel nurses who work for private agencies, and I can table that. Despite this large sum, our nursing shortage is not going away. The Nova Scotia Health Authority continues to have over 1,000 nursing vacancies. Too many of our nurses are having to work 24-hour shifts, while others have to work up to 6 days a week. This is leading to burnout and nurses leaving the line of work. The travel nurse program is making it worse. On top of burnout, local nurses are working next to travel nurses who are making much more money. Why is this government continuing to throw money at private nursing agencies when the perceived solution is clearly not working?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. So we know that there is a provincial and national nursing shortage. We have to use travel companies right now. There is no other alternative. It allows us to keep beds open. There has been an underinvestment in nursing education for a number of years, which has resulted in this nursing shortage. We are raising the number of seats. We are recruiting. Our Patient Access to Care Act is bringing people in from all over the country. If we were to walk away from travel nurses, we would have to close beds in this province, which we're not willing to do. What I can tell the member is we're one of the first jurisdictions in Canada to actually limit the use of travel nurses, and we're anxious to see what that will result in as the time moves on.
The honourable member for Dartmouth North.
Janet Hazelton, the president of the Nova Scotia Nurses Union, has presented a clear solution to this government. She would like to see nurse locum program in place of their reliance on agency nurses. In a committee earlier this week, she said, quote, "It's very doable. All it's going to take is for the unions and the employer to sit down and negotiate this. We just have to do it." I can table that. When asked about such a program, the department said talks have been limited. So will this government listen to what nurses are saying and implement a provincial nurse locum program?
I recognize the Honourable Minister for Health and Wellness.
Moving the same number of people around in a different way in a province is not going to help our nursing shortage. We have done a number of things. We've increased the number of seats. PACA, which that member voted against, will bring nurses from all over this country to Nova Scotia, enabling them to work within 5 days. We are looking at immigration strategies. If we have to raise the supply of nurses, we need to train them. We need them to come and move and live and work here. We have a competitive contract. We are an incredible environment to work in. There are a number of things that are happening through the new collective agreement and by the employers to improve conditions for nurses, and I am confident in our ability to address the nursing shortage.